The National Health Service in the UK has approved PET scans for staging prostate cancer after the initial diagnosis to determine, ideally, which is whether this patient is a candidate for local curative therapy or not. So just out of curiosity is, how has the initial disease staging changed or been modified over the last several decades, from bone scans and CAT scans to now even the consideration of PET scans? And do you think that this will actually have any impact on how we'll alter our treatment recommendations?
Yeah, thank you, Michael. Thank you, Tom, for allowing me to participate tonight. And I just want to take a second to thank Michael, who's put this foundation together, who's the motor who drives our health foundation. Thank you for everything you do. I want to thank you on behalf of all the men of Southeast Michigan who unfortunately suffer prostate cancer, but through Michael's determination, passion, and just outright care for others, we've developed a foundation that's helped thousands and thousands of men and women and families. So thank you for everything you do. Getting back to your question, it's a great question, because the Europeans have been far ahead of us with PET imaging. And that's just kind of how the health systems of Europe work, is they are very open, or they are very early adopters to imaging, where the US, it tends to take a little longer. It's a little bit more restrictive. However, we do offer, medical therapies are pretty wide open, and patients can get medical therapies, new drugs, new chemo pretty easily, whereas Europe, it tends to be more restrictive. So with that being said, the Europeans have been putting out some pretty exciting data. And I think if we're going to take home anything from tonight as we talk about these new imaging modalities, is the future of prostate cancer is going to be PET-based imaging. We are going through a significant revolution in imaging, and Tom and I will highlight some of the trials and some of the data that's coming out, which we are going to be moving away from conventional imaging, CT and bone scan, because these new imaging tests are really that great. They're really that much better than what we're using today. So the NHS has, offers PET imaging for the staging of diagnosis of prostate cancer, but the US is really not that far behind. Just a couple months ago, the NCCN guidelines, which is kind of the Bible or the rules that we follow on how to treat prostate cancer, did list PET imaging as an option for staging patients. And to their credit, they didn't require that the patient have a CT and bone scan. That sounds great, but it always is, and this is just American US healthcare, it does take time for our payers to catch up with the guidelines. But in January 1st, Clarify will be available. We've had commercially available Oxymin. So we've had PET imaging available, and in the coming years, as the payers catch up, we are going to be using it more and more. So getting back to your question about the diagnosis and staging of prostate cancer, there was a great trial that I think we need to talk about, is the Osprey Trial. It was a phase 2, phase 3 trial done in mostly in the US, a couple sites in Canada. And what they did was they did conventional imaging first. They did a CT and a bone scan. And then the patients that had essentially near 100% negative CT and bone scan, they then did a new test called the Clarify, a new PET imaging. And then they took them to surgery to see how many the CT and the bone scan missed compared to this new test, this new PSMA PET imaging. And what the Osprey trial showed was that over 20% of the patients were upgraded, that the PET imaging, the PSMA study, found cancer that the CT and bone scan didn't find. And not only did it find more cancer, and there was a couple like technical issues, but it did show improved sensitivity when the lymph nodes were larger. But it did show, which also is very important, is that when the PSMA was positive, that the likelihood that or the positive predictive value, the likelihood that that positive test was cancer, was 3 times better than what we're using today. So I think that we are almost there. It's in our guidelines. The payers will catch up, where we can get away from doing CT and bone scans in high-risk disease and go right to PET imaging.
Wow. So I guess out of curiosity, do you think that we're going to be done with PET with bone scans and CAT scans and just do purely PET imaging?
That's a great question. And, you know, I think time will tell. These tests are very expensive, you know, so we got to be selective on who we do it with. If you look at the trials, you know, we still follow patients with CT and bone scan. But, you know, I think as this evolves, I think we probably will, but I think it's too early. The PET scans are great. We know the accuracy and the sensitivity are better than conventional imaging, but they haven't been validated in FDA trials yet to show that they're effective endpoints. But eventually that will come. It's just going to take some time to flush that out. But I don't think that's not an unreasonable idea that we would just go purely PET. But I think today, where we use PET imaging is going to be in the initial diagnosis and staging of high-risk prostate cancer. And then in the biochemical space, we've been using, Tom mentioned it, the oxymum, fluciclovine. We've been using that for many years in the biochemical space. And then I think in the advanced space, we'll be using a lot of PET imaging as they've done in the last few years in Europe.
Okay, great. Thank you very much.